this is Mark Adajar, one of the doctors at XSculpt. I wanted to talk to you, especially if you're one of my patients, about our Phentermine therapy. If you're not one of our patients, welcome, and hope you learn something about about this medication and how to take it. So, Phentermine is a medication that we prescribe under medical supervision to help people who have difficulty losing weight. Now, Phentermine, what it is it's a stimulant type medication. It is FDA regulated, so it does require a doctor to actually write you a physical prescription for you to take it, as it's monitored by the FDA on its use. Now, the way it works, it's a stimulant, and so as a stimulant, it does several things. It drops your it drops your cravings. I like to tell people it's like when you drink a cup of coffee. You know, after you take a big cup of coffee, 30 minutes later you don't feel like eating. You just don't have any hunger or cravings. Phentermine works like that. Also, because it's a stimulant, it can raise your metabolic rate to allow your body to mobilize fat stores a little easier. Also, if some of the research has shown that it also has another weight loss property, but they don't know what it is specifically that causes it. But I think it's generally accepted that it basically takes away your cravings and it boosts up your metabolism. Now, the main question is, so how do you take it after this is prescribed to you? So, Phentermine tablets comes in a 37.5 milligram tablet formulation, which is scored, which basically means it could be divided. So the way that we recommend you taking it is you should take it, first of all, in the morning on an empty stomach. You shouldn't take it within 2 hours of a meal. So it should be on an empty stomach. Now, when you start taking Phentermine, everybody's a little bit different on how it works with them. Some patients can take a full tablet in the morning and it lasts the whole day. Some people take half in the morning and half around maybe 2 o'clock or 1 o'clock, and to get a longer effect. Sometimes half a tablet's too much for some people. They get some of the side effects, which we'll talk about later, and they have to divide it up into 2 separate times during the day, which is fine. You just kind of have to play with your body, listen to your body about how cravings work and all that stuff, and adjust how you take it accordingly. Okay. Now, because it's a stimulant, you should decrease your regular caffeine intake, because you take the Phentermine and then you take your regular cup of coffee right after. Then your heart rate might shoot through the roof. You get very jittery. You can get very anxious and mind racing, something you don't want. So you have to modify your caffeine intake. I do recommend you also watch your alcohol intake regarding it, because alcohol is a depressant, and then you're taking a stimulant, and you can mess up your body that way. Very important to drink at least 2 liters of water a day while you're on Phentermine to help flush out your system. The Phentermine, it's often reported that people report a dry mouth, so you would need to drink a lot of water a day, which is good for you. So drink at least 2 liters of water a day. Okay. I generally recommend you don't take it after 4 or 5 p.m. at night, because you won't go to sleep. It's a stimulant. You'll just be awake through the whole night. And so if you're going to take it a bit later in the day, don't take it after 4 or 5 p.m. at night. Again, maybe take half a tablet sometime before then, so it lasts you a little bit longer, but just not into the evening. Okay. Now, some of the things to be careful about when you're on Phentermine is because you're calorie restricted. Basically, you're restricting your calories because you're not going to want to eat too much, and when you do eat, you're going to feel a little bit satisfied earlier than you normally do. You have to be very careful about nutritional deficiencies. So I do recommend taking a multivitamin while you're on the Phentermine, just to make sure you get your daily requirement. I do also recommend working out while you're on Phentermine. just to be overall healthy, I do recommend weight training especially. However, you have to adjust your workout because you're going to be taking in less calories, and so you might not be as strong because you don't have that energy reserve, or you may not be able to run as far because you're on a more of a calorie restricted diet. So you have to be careful. I don't want you trying to hit personal records and then have the weight fall on your chest because you don't have that much energy. So please adjust your workouts accordingly. Now you have to also, as funny as it sounds, you have to remember to eat. When you're on this, when you first start out with Phentermine, it's not unusual for people not to eat for 24 or 36 hours. And as a result, you can get hypoglycemic, you can pass out, you can feel extremely fatigued. So you have to eat while you're on the Phentermine. I know it sounds weird to say that, but you have to remember to eat. And it's also not unusual, is when the Phentermine wears off, your body has a bunch of cravings. So you have to make sure you control your intake when the medication wears off. Okay, so we've had people who report extreme fatigue, and then I ask you, when's the last time you ate, and they say like a day and a half ago, and I'm like, well, that's why you're not feeling so hot, is because you're working out and everything, you're not eating. So you do have to still eat every day, but you should watch what you take in. Now I feel that Phentermine works best with an intermittent fasting type protocol. If you don't know what intermittent fasting is, basically it's where you take your calories in within a certain time window or time frame during the day. One of the most popular is 16-hour fast, which includes sleep, and then 8-hour eating window. So, some people stop eating at like maybe 6 p.m. and then they go all the way the next day until about 12 or 1 p.m. and their eating window is probably like either 12 to 8 or something like that. I'll make a video on this later, but there are much better videos on YouTube, or you could read about it online, who does amazing jobs about it. But Phentermine works best with intermittent fasting because it does hold your cravings to want food until later in the day. So I do highly recommend that you use an intermittent type fasting diet with Phentermine. Another thing you have to watch for is that this medication should only be used for a 90-day cycle at most, because what happens is that you can build a tolerance to the medication. So what happens is after 90 days, your body won't respond to it anymore, and then you are only exposed to the side effects. Now, the main side of the one side effect that you have to be most concerned about is that because it's a stimulant, it could be addicting. So that's why we personally don't prescribe for more than 90 days at a time. You can take it for 90 days and then be off it for about 6 weeks and then restart it if you need to. But you shouldn't be taking it every day for months at a time, because it just stops working. I personally discovered through my own use of it is that for me it works best is if I use it every other day. If I use it for 5 days straight, I've noticed on the 6th and 7th day it doesn't work as well. So I like to use it like Monday, Wednesday, Friday, and then not take it on the weekends, and then restart it again. It just works that way best with me, and you have to kind of experiment with what works best with you. But definitely not more than 90 days straight, regardless what you do. Okay. And I think that's about it. So if you have any questions on this video or about Phentermine, please leave a comment below and I'll do my best to answer it. Hopefully we will see you in our clinics so we can start you on our weight loss program with Dr. Batista, one of our weight loss experts. And if you're in Chicago, we hope to see you soon. Thank you very much. Have a good day.